I've been sitting here for about 5 minutes debating whether to hit the record button or not. This video has been about 18 months in the making. And it's a bit disappointing that I'm having to make it, but there probably aren't many videos like this out there, so I wanted to share my experience. So about 18 months ago, January of 2024, I had my first knee replacement. After about 5 months, I got very, very sick. I didn't know it at the time, but I got basically septic from an infection from the knee. Nobody's to blame. It's just something that happens. And I say the first time because I've been trying to avoid this path if I can, and I've been working really hard towards it for 18 months. But after about, like I said, after about 5 months after my initial knee replacement, total knee replacement, I had gone to the gym the night before and pushed it a little hard, trying to, really work on that strengthening of the knee. And the next morning I was in a company meeting and started to feel really bad. My knee was hurting, and I'm diabetic. Thankfully, well controlled now. But in a meeting, and I started to have this really just awful, weakening, dizzy, sweaty moment that I typically relate to a low blood sugar, like a really low blood sugar, somewhere high 50s, low 60s, something like that. And we were at towards the end of the meeting, and I just kind of had to interrupt and say, guys, is there somebody here that has some candy? It's like, I'm feeling awful. Ate some candy, tried to give it like 10 minutes, and I just kept going downhill to the point where I had to tell somebody, it's like, you guys need to call an ambulance. I don't know what's going on, but I'm really crashing hard. And I was in a full-on sweat. The conference table that I was sitting at was covered in moisture. And I was literally struggling to stay conscious. I knew, they had called the ambulance at that point. I knew they were on their way. But I was fighting to stay conscious because if I was passed out, I couldn't tell anybody what my symptoms were or what was going on. Thankfully, the paramedics got there before I passed out. But one of the things they did was they took my blood sugar, and instead of it being really low, it was really, really high. That's because I ate the candy when I didn't need to. But my knee had accompanied this with this. My knee was like really, really sore, really hurting. And I kind of was initially chalking it up to having pushed it kind of hard at the gym the previous day, and just kind of thought, well, this is just, me overdoing it a bit. Got to the ER, and that initial pain that was pretty strong became very, very acute, where we went through multiple types of pain medicine to try and get this pain under control, because I was out of my mind in pain, like 10 out of 10. And nobody really knew what the problem was until we got some blood cultures back, and my white count was like, I don't know, 30,000 or something like that. It was extremely elevated. And they were able to determine that just because I kept complaining, my knee hurts, my knee hurts, my knee hurts, but that knee had become infected. So got checked into the hospital, and the next morning had to have what's called a clean out, where they open up the knee, they clean out all the infection, and mine was very infected. Apparently there was dead tissue in there, along with pus and all the other kind of crap. But when they do that clean out, they also replace what's called the spacer, which is the plastic knee part, or the plastic part behind the patella, is my understanding. So went through that about 5 months after the initial replacement, and kind of thought, this was a fluke. Got in a post-op infection somehow, some way, but weird that it had taken 5 months to develop. But got through that surgery, and kind of thinking that I was done. It was like this was kind of a one and done thing, a fluke, and that was the end of it. Unfortunately, about it must have been another 4 or 5 months later, and I kind of wish now that I would have done videos of those, but hindsight is 2020. So, but about 5 months after that, maybe it was 6. Again, I got really sick, just very rapidly. This time, or that second time, I kind of understood, having been through the experience once before, that the way I was feeling was extremely similar to the first time when I got sick. And I was like, uh-oh, this is probably knee related. So went into the ER. They, gave me, again, lots of different pain meds to get on top of things. And again, my white count was just super high. I don't remember if it was 30,000 high, but it was at least 20,000. And they're like, yeah, you're septic. That second time, I was actually septic, as in my whole system had been attacked by this infection. It was in my blood. I was a very sick person, and I was in the hospital for I think about a week. But during that process, they went in again, washed out the knee, replaced the spacer, and the discussion about